One of the hardest things is seeing your dog in discomfort. Has your dog just had what's called a vestibular event or vestibular disease? Well, this video is for you. Today, I'm going to talk about a home treatment you can do that can help your dog right away. The maneuver we're going to do today is called the epley maneuver. And this is a maneuver that they do for humans, for people that have vertigo. So some people, every morning when they get up in the morning, they have to do this maneuver to be able to get up and not have the world spin around. And remember, stay through till the end, because I want to give you very clear instructions of when you should not do this. Here are the items needed to do the epley maneuver, which is the maneuver I'm going to show you to help resolve vestibular or vestibulitis. You're going to need some treats. Now, some dogs probably won't take treats because they're feeling nauseous. You're going to need, obviously, your dog. You're going to need a beach towel. And this is optional. When I show you, some dogs may not respond well to this. You need a timer, but you want to make sure the timer is set to the side so that you can easily see the time ticking. The other thing you're going to need is a pillow or something like a pillow. And we're making a little cradle here. So basically, just to give you a heads up of what's going to happen, I'm going to take this towel, I'm going to wrap it around him so that he can't be flailing his legs in the air. Now, if you think you can do this without the towel, that's totally fine. What's going to happen is I'm going to put Ben on his back with his head over the side here. And I have these pillows here so that he can't rock off. We have to move this a little. And I'm going to be on this side. So let's give this a whirl. Now remember, a dog with vestibular, it is not typically life-threatening. Usually within 48 hours, the symptoms improve. The symptoms will improve and may take up to 3 weeks to resolve. Having said that, I've seen some dogs take longer than that, but typically the vomiting and the nausea that your dog gets will dissipate within the first week. It's just sometimes you will see, for the life of your dog, a head tilt. Let's get started. Lie down. There. Yeah, that's good. Good boy. So now, got him on the pillow. And actually with him, I don't think I really need to use a towel, but we will try. And basically, I'm going to wrap this around like so. Dog is lying here. And I am going to try and maneuver him onto his back. Now, when your dog has vestibular, it's a lot easier to maneuver them than a dog that does not have it. And what we're going to do is put him on his side. Good boy. Good boy. Ooh. Relax. Good boy. And what you're going to do is, first of all, you want to make sure he's on his back. Hence the towel. Good boy. Good boy. Okay, bend, bend, bend. That's it. That's it. Oh, you good boy. Good. And just let them calm down a little, because this is going to scare your dog a little bit. And if it's the right side that's affected, you're going to bring his head over to the side. Good. Good boy. Towel comes in really handy here. And you're going to have your dog's head to the side for 2 minutes. And you should see the eyes start to stop going from side to side. And you're going to hold that for 2 minutes. And this is why you don't want your other dogs or children or anything happening, because it is a little scary. And then we're going to roll them this way. Again. And the key here is you want the head to be lower than their body. And the reason for that is because you're trying to roll the crystal back into the labyrinth of the ear, which is maintaining their equilibrium or balance. So again, we lie here for 2 minutes. And then, once we've done that, good boy. The hard part here is really what you want them to do is when they get up, you want them to come forward, up this way. Good. And then I'm going to give Ben, the demo dog, a treat because this was not enjoyable for him. Good boy. And something to remember, when you've done this maneuver, you may want to put a donut or an air collar thing with something on the side so that they don't lie when they go to sleep on the affected side. So in this case, it would have been his right side. You want them to avoid that because it can roll the crystal back out and ruin what you just did. Some of the things to watch out for. So when you do this, if your dog has nystagmus going up and down, do not do this maneuver. This is something where you really need to go to your vet and talk to them because it can be indicative of something else, not vestibular. The other caution here is, and this is some say it's okay, some say it's not, but for me, if someone brings me a dog and it's a week or two later and the nystagmus is stopped, I don't generally try to do this maneuver. And I may or may not be right here, but in my humble opinion, if I go to do the maneuver and they don't have nystagmus, it's possible that I can unroll the crystal out of the ear when I go to do this maneuver, and then they start to get the nystagmus all over again. So in my mind, if the nystagmus is gone, I would not do this maneuver. One other thing, and this is not a caution, but I have seen a number of dogs that I've seen, and I haven't been able to get the epley maneuver to work. And then subsequently have found out the dog has an inner ear infection. So I would make sure first, just check inside your dog's ear, try and look way down in there if there's any crusty or something that looks a little off. It is possible that your dog has an inner ear infection, which is causing the vestibular. So that's just something from my experience that you may want to double check. Right? You guys are terrible. Oh boy.